So how would you, convince my boss? Right? I'm realistic here, right? I report to someone reports to someone else. How do you even convince my boss that my well-being is important?
I mean, we have been working with quite a number of companies
Right.
Since 2006, and it has never been easy.
Yeah.
I've spoken to some employers, and some employers start telling me, "Hey, Porsche, you're telling me to invest in mental health.
Yeah.
You know what? If I wanted to do that, I would have set up a charity. Why am I doing a business?" That was the message I received from one of the employer. And the thing is, I didn't give up.
Yeah.
The thing is, somehow it's a blessing. Shortly after the conversation, and this boss started contacting me
Right.
and say, "Hey, Porsche, there's something happening in my company.
Yeah.
They start taking a lot of medical leave.
Right.
And their performance start deteriorating.
Yeah.
And how shall I address this issue?
Right.
And on top of that, they have quite a number of accidents at the workplace.
Right. Okay.
Then I said, doesn't it reflect negatively on your company?
Yeah.
And I said, yeah, can we talk? Can we meet out to discuss further?
Yeah.
I said, okay, look here, I don't want to be seen as if like selling my service or whatever. Anyway, whatever revenue we have is to sustain our charity,
Right.
to serve the community. So finally, he paid attention to me.
Yeah.
I said, even if you're not paying me, right, can you allow me, like what Joe said, let's have just a lunchtime talk, a gathering. Sometimes you don't even need to have a talk. Can I speak to your staff?
Yeah.
Without the management staff around.
Yeah.
So I start talking to the staff, and it felt very easy, free and easy, because their management were not around.
Right.
And they start sharing their challenges. I said, no, look here. Your boss didn't pay me a single cent, okay?
Yeah.
I'm a neutral party.
Right.
I focus so much on mental health,
Yeah.
So they start pouring out and they start talking about that. I said, so what you look forward to see in your company if
Yeah.
you stay on for another 5 to 10 years? And then they start sharing some, and I start collating. Are you okay for me to share this with your HR or your boss? And they said,
Right.
yes. So with your permission, I'm going to be your messenger. So after that, I talked to the boss, and then they said, what can we do? So you can customize. I mean, like, for example, you mentioned about, the employers need to do this, do that. Not necessary. At least they need to pay attention to mental health, the importance
Yeah.
of mental health. That's something that the main request. So if you are willing to talk about it, I'm willing to work with you on that.
Right.
So it's according to the size of the company, according to the budget, according to like the number of manpower and what are the challenges they face, because there's no one size fit all program on services.
Yeah.
So at least like some will start with like just a lunchtime talk to raise awareness. Some are willing to work with us on some mental health project. So we can do different things. And it doesn't mean that all must start having talks,
Yeah.
all must start having a buddy system in the
Right.
company.
Yeah.
So it depends. At least you start from somewhere. And they see the value of it. For example, I'm ready to announce, because like Jardine, Mindset Care, we have been working with them for 10 over years. And they are willing to fork out their time, because there are some companies who say, okay, Porsche, you're telling me to block half a day for my staff.
Yeah.
They're supposed to be doing their job,
They're
I
supposed to
say,
make
see
money.
the value. Yeah, see
Yeah.
the value in it. And they start, giving in. So for Jardine, they actually involve their directors and managers to attend some training. Whether it's a 1 day or 2 days, we just customize according to the availability.
Sure.
And once the management are able to look out for the warning sign and learn how to manage the mental crisis in the workplace, crises do happen.
Of
At
course.
first I said, sure, are you sure? True enough. And in fact, there are some workplace after working with us, and they start calling us, hey, there's a crisis,
Yeah.
I managed to look up for this warning sign. So, Porsche, what should I do next?
Yeah.
Then we'll provide all the resources for them for their consideration.
Right. So one crisis is one crisis too
Yeah.
many.
Yeah.
Fire is not real until
Yeah.
it becomes real, right?
Correct.
So a lot of times, employers, right? My boss, you're hearing this, right? So if you're my boss, if you're hearing this, you will understand the
Yeah.
situation that each of us are in. It's never a one-size-fits-all journey. It's never a blueprint that says that try this, it will surely work. Come and talk, come forward, understand the needs of your people, because you have the pulse on the ground. What motivates them, what keeps them productive, why is high absenteeism, low engagement, high staff turnover, how we can actually resolve this using just a little step, right? Understanding your people. I think that's really, really important when you pointed out as well. I draw that from your message as well. But I want to wrap this up, right? Because she provided a feedback loop, and then she says that, well, with the feedback loop, organizations can improve. Then what? Right? I mean, I want to post this to Joe, right? Because then what? You mentioned companies have what's next, right? We stopped there, but what's next?
Yeah.
I want to know what's next, right? As an employee, I want to know.
Yeah.
Yeah.
Let me try and answer this question with a example. So about a month and a half ago, I was having a meeting with a multinational sales-focused organization here in Singapore, and it was an introductory session to tell them, to inform them, this is what the Wellbeing Champions Network is, this is how we can help them, and etc. And then halfway through the conversation, there were several people in the room, and one of them was in HR. Or actually, two of them were from HR. The HR manager suddenly stopped me in the middle of the conversation, and they said that they needed to draft mental health policy for the company. So I asked them, you don't have one at the moment? And she said, no, I don't have one. I said, so you've drafted one? I asked this person. So they said, yes, they've drafted one. And they then asked me, said, do you mind if you help us review this right now? I said, okay, very strange request, but okay, since I'm here, I'm okay. So they flashed it up on the screen, and I looked at it. I thought, it's a version 1, a draft maybe. I thought, it's not bad for a first version, I guess, but immediately you could point out, there are some gaps here and there. And then I asked a follow-up question, how did you do this? Because it didn't seem as if this HR manager was in full awareness of all of the things that, necessary ingredients that would go into crafting and drafting a comprehensive mental health policy. So when I asked them, how did you come up with that? The answer was, I Googled it.
No.
They Googled it. Now it's not in itself bad. That's okay. I mean, it starts as a reference point.
At least they Googled it.
Actually, at least they Googled it. But and I said, okay, as a start, I think it's okay. But these are the areas which you can improve. But when you do that, it completely that's something. An example that you found is for some other organization, probably not even a local organization, developed for their context, right? It fails to account for the uniqueness and the context in this person's organization, right? So there's an awareness that we need to come across. I think with this person that Porsche was talking about, approached them back, months after the initial conversation. They said, can you please help us, because we've noticed increased absenteeism, presenteeism, right? That's another big one. Accidents, right? And all these kinds of things, right? I think what we need to do is really underscore the link, right, between well-being, employee well-being, and organizational performance indicators.
Right. So if you can find that link.
Those links are already being mentioned, right? Absenteeism, presenteeism, MCs, medical certificates,
high staff turnover,
a level of employee engagement, accidents. There's probably a few more. These are already metrics, right? What's missing is the attribution of these metrics to employee well-being. So it needs to be, you need to make this connection. You need to make this connection quite tight. So if you can make that connection quite tight, then when we make the business case to the organizational leader to say, we need to do more, we need to put more budget, or we need to assign more headcount to this, and this is the reason why, right? And you are able to put together through data, right, that there's increase in absenteeism, there's increase in accidents, there's increase in right? And evidence shows that by addressing the hygiene factors of employee well-being would improve those numbers, then we would be able to scale this across more organizations. It would be easier to get more buy-in. I think this is a message that we are trying to get across to our champions as well. Yes, you start with an awareness building exercise like organizing an event or a talk, and that's a great place to start. But now, if you want to continue to do this over time, you need to make a business case to your senior leader. And
right.
This is how.
And that's great. And that brings us nicely to a landing, right? We have to end an episode somewhere, sometime. So I want to say thank you. But before I let you go, one final question, right? What would you tell employers? Why should we take workplace well-being seriously? The final message, right? Just one message. And I will reserve mine at the end, right?
I think it has to be to be taken seriously because just leading on from what I was just mentioning, right? There are clear links between employee well-being and organizational performance. There are clear links now already. The only links that are missing is specific and to the context of that specific organization. But globally, the links are becoming extremely clear and apparent. And this is then coming across through pulse checks, employee engagement surveys, well-being climate index and surveys, even through 𝗲𝗿𝗹𝗶𝗲𝗍, for example, we talk about. There are no lack of assessments and no lack of tools and metrics for which to be measuring the attribution of employee well-being to organizational performance.
Right.
There's no lack of resources and there's no lack of support that organizations can look to help them kickstart their journey.
So I'm shifting the attention back to Porsche, right? What's the final things you want to say to employers out there? Why taking mental well-being seriously?
Actually, I have 3 points. And the first point would be, according to World Health Organization, no health without mental health. So we really need to have a good mental well-being in order to move on with our life, to achieve our goals, whatever goals, whether to complete our studies, to perform our work well. It depends. And second point would be, although the COVID situation has improved, but the thing is, according to studies, still a lot of people are feeling stressed.
So that's a post-COVID.
Post-COVID stress. So we have to look into that. And the third point will be, let's be frank here, our workplace is our second home. And the second place that we spend more time with. And we have to make sure it's a safe space, and everybody is comfortable with each other and check in with each other, and ensure everybody is having good mental well-being. Thank you.
Right. So thank you very much for being on my show today. Let's talk a little bit about mental well-being, right? So ladies and gentlemen, if you like the show, please, I invite you to like and subscribe, right? So please do that and hope to see you soon. Bye.